Good afternoon and welcome. This podcast is part of the work of the Victorian Bicultural Workers Network, facilitated by CoHealth's Bicultural program. Through these conversations, bicultural workers share their community's experiences of mental health, wellbeing, and accessing supports. These stories are shared to help mainstream services better understand the needs, strengths, and perspectives of refugee and migrant communities, and to reflect on how they can work more effectively and safely alongside them. Before we begin, we acknowledge the traditional custodians of the land on which this podcast is recorded, the lands of the Wurundjeri, Wurrung and Boonwurrung peoples of the Kulin Nation. We pay our respect to elders past and present, and we acknowledge that this work takes place on stolen, unceded land. We recognise the enduring leadership, strength and wisdom of First Nations people in navigating, surviving and challenging colonial systems and in bridging divides to support the wellbeing of their communities. My name is Jasmine and I'm the Bicultural Program Lead at CoHealth. Joining me on the podcast today is Dawt Thang Eng. Hello, Dawt.
Hello.
So nice to have you here. Dawt and I have worked together for many years in the Bicultural program. I'm so stoked to be able to have this conversation with you. So thanks for joining us.
Thank you for having me, and I'm very excited to be here today.
Dawt, let's kick off. Do you want to introduce yourself? Tell us a little bit about you and your cultural community and also your work.
Yes. My name is, as you said, Dawt Thang Eng. I am from the Chin community, and I've been working within the community since 2019, before COVID, and it's still ongoing as well. I also work as a registered psych nurse. I am mainly working in inpatient unit. I have experience in other units such as working with young people, rehab, and eating disorder as well.
Amazing. Dawt, tell me a little bit about the Chin community, and I guess let's start with strengths. What do you think are some of your community's greatest strengths?
I think our community, we have a lot of great things, and that factored as a strength base. One of the strengths we have is we always share our struggles, our challenges, our sadness, and our happiness. And that's usually from our cultural perspective, and it's strongly embedded within our community.
Beautiful. You've started talking already about people sharing their challenges with each other. How does your community talk about mental health and well-being? Are there any words or concepts that exist in your language to describe it?
To my knowledge, we don't have enough or sufficient words or vocabulary to describe certain feelings. And when we talk about it, certain mental illness, we can generalize it and explain what you feel, what you experience. But a lot of the terms that we have in English, we don't have in our dialects.
And so when people are talking about their mental health or well-being generally, how would they describe it to somebody?
I think instead of directly mentioning what they think they are diagnosed with or what's going on in terms of clinical perspective, I think they are more willing to share what they're experiencing and what they are feeling at certain time and certain period with a certain circumstances and situation, instead of directly saying this is a mental health challenge.
I think about the different conversations that I've had in my lifetime talking with both people from diverse communities and my own family and friends who are born and grown up in Australia. And sometimes I think people who grow up here, we do have the language to talk about mental health in terms of anxiety or depression or those kinds of things. But sometimes people also will just talk more about the symptoms. Do you think it's a question of mental health literacy? So knowing what those conditions are and being able to attribute the symptoms to yourself?
I think that's one of the major element, yes. And another thing is we have to take into consideration that within some culture like mine, to talk about mental health, it it's a very stigmatized topic to have a discussion as well. So for majority of my community member or the Chin community member that I have spoken to, I think they felt more comfortable and more confident just to tell you what they experienced, just mostly focus on the symptoms.
Mm.
And also, like I said, and you've mentioned, that might be due to literacy aspect as well. And also the stigma, instead of like mentioning, oh, I've been diagnosed with this and that, they probably feel more comfortable to say, oh, this is what I'm experiencing.
If people are seeking help or needing to seek help for their mental illness, who do you think they would speak to first? Are there any traditional or cultural ways that your community would seek support for their mental health or perhaps get a diagnosis?
A lot of the time, I think because of the way our culture has been set up and how our religion is so embedded within our culture, they are very intertwined. And the first person they will probably go is someone they trust, obviously. And the second would probably be our pastors and our community leaders instead of just going to their GP. Another barrier that we have to keep in mind is that the language barrier, like we've mentioned as well. So a lot of the time, they might not want to have interpreter when they want to talk about their mental health and well-being. So I think
Mhm.
they feel more comfortable to see the pastor because our religion is very embedded and we do believe that we should seek God for our challenges and our issues as well.
What do you think would happen if a person who is experiencing mental health challenges went to their pastor? How would they get support in that instance?
A lot of the time, even to my personal knowledge, I know that the pastors are trying to get help for them, helping them to contact their GP, encouraging them to go to emergency department, encouraging them to be in contact with support services. But they can only do so much of that as well.
How do you think experiences of migration and resettlement are influencing their experiences of stress or mental health?
I believe people who arrived before or around 2010, what I have noticed is that they seem more relaxed. They find it easier to settle here in Australia, whereas people who arrived after that, say like on 202 visa, there are limited support available for them. And also what's happening currently in Burma, the military coup, that does not make it any easier for them. They worry about their families back home. And when you arrived, even though you're a refugee and you arrived here on 202 visa, a lot of people are experiencing financial stresses because they have to send back money to their family to support them because they are losing their houses. It's just basically a war zone right now. A lot of financial support that needs to go to their loved one back in Burma or even in the refugee country. So
Mhm.
feel like I believe that they experience a lot more stress and anxiety compared to the ones who arrived here back in 2010 or around 2010.
And do you think that's because of a change in the type of visa that people are being given now post 2010, as well as the increase in conflict back home?
Absolutely. And
Yeah.
a lot of support services say if you arrived as a refugee or under humanitarian visa, there are a lot of support services that you can have. You will have a case manager, you have access to certain services. And whereas when you arrived on a family or a 202 visa, those services are quite limited as well. It still is a humanitarian visa, but you can't sponsor people back in refugee country, and you'll have to have a guarantor from here. So once you arrived here, a lot of the responsibility falls on your guarantor rather than having access to those support like a community guy, a case manager that looked after you, that booked appointment for you and things like that. Now
Yeah.
you either depend on your guarantor or you have to fend for yourself.
It's such an important thing to note, isn't it? Especially for mental health services that are providing support to refugee communities, is that depending on the visa pathway that a person came from, the support services and eligibility will change, but doesn't mean that their experiences are any different to a refugee who came through a humanitarian pathway, say. So the mental health challenges, the settlement challenges, system navigation, literacy, all of those things may well be very much the same, but they would have a very different available support system for them in accessing and building relationships and trust with mainstream services, no doubt.
Absolutely, yes. A lot of people or the Chin community members, we have a very similar experience regardless of what type of visa we arrived here. But
Mm,
because of the type of visa, once we got here, the service that we can have access to is very different. And
mm.
it does have a lot of challenges for some people who arrived on certain visa, yes.
And I know working in refugee health, there's many of those guarantors or sponsors themselves have come from refugee backgrounds and may still be struggling themselves to navigate the mainstream system and know how to navigate things like Medicare or case management or service support or accessing GPs, all of those kinds of things. So the government is almost shifting responsibility onto that person without necessarily knowing that they have the skills and confidence to support somebody once they arrive on a 202 visa. Such an important consideration.
Yes. And also imagine someone arrived here, even as a refugee, regardless of their visa, if they don't have support when accessing mental health services or medical services, language barrier itself can already stop them from accessing those services.
Absolutely. And not to mention our systems are so complicated. I was trying to help somebody the other day access the renewal form for their Medicare card because they've been refused access to a GP service as a result of their Medicare card having expired. And even myself, having grown up in Australia, English is my first language. I know how to use MyGov. I could not for the life of me find the form on the system in order to tell him where to go to fill it out. And it's just a perfect example of how convoluted our systems are, and they're just not designed for people who don't have English as a first language, or let alone people who might have literacy barriers.
Absolutely. And that's why we need a lot of community workers. We need a lot of bicultural workers just to bridge that gap as well.
100%. Don't worry, I'll get to the questions about why we need bicultural workers soon. I want to ask, and I think we've already really started talking about this question a lot, but I wonder if there's any other challenges that people, whether they come by 202 visas or any visa, what are the challenges that they face when trying to engage with mainstream mental health services?
I think a lot of people don't know what's there or what's here. They don't know what kind of services they're entitled or they can have access to without having to pay for it or what pathway to take. I think the initial first step is very difficult for them. I've not too long ago I had a community member like they rang me and they were struggling to refer their loved one to the mental health services just because they don't know that they have to go through triage, they have to go through ED, and they have to go through what we call like community or crisis assessment team and all of that steps. They didn't know any of that. So they just thought they can just come to the hospital. But once they show up to the hospital, they have to be turned away and ask them to do all this step. And I think that's one of the main challenges when accessing mental health services in here.
Especially at that end when somebody has become extremely unwell and needing emergency support. I wonder, daughter, if you could tell us a little bit about your perspectives on once a person is able to access a mental health support service, whether that be in a hospital setting, like in your experience at work, or maybe a community-based mental health service where they're accessing counselling or psychology in a more preventative or recovery space. What do you think about some of the approaches to Western mental health interventions, and how do you think they align with your community's views around mental health and accessing supports?
So I think, say, once a person has been admitted to an inpatient unit, usually it's short term acute inpatient. I think they will be receptive to treatment and intervention at that stage from like psychiatrists and all the other treating teams or the stakeholder that's usually involved in consumers care, such as social worker, PT, nursing staff, psychologists, and all of that. However, post discharge, to have access to counseling, I don't know if they will be very willing to keep going and talking to someone about the same thing that they've been talking to, because like I said, a lot of the time many people have challenges with just talking instead of actioning it physically. That part I am not too confident that they'll be very willing to access, and also considering the stigma
Mm.
there as well. And if another thing is community, say someone is on a depot or long acting injectable medications, I think they might be engaging. I believe they will engage to a certain level unless they are declining in like their mental state. And sometimes people do believe that, oh, God has healed me, and they stop engaging as well, in my experience. So things like that does happen. I think it's a lot of the time depending on where you are with your mental health well-being as an individual.
You bring such an interesting insight to this conversation because you are working in the hospital setting. Most of the people who we've interviewed in the podcast so far have been working more in the community space. An interesting theme that I'm hearing across all interviews is that for a lot of communities, the physical health component is what they feel more comfortable in seeking medical intervention for. Whereas it's the talk therapy and the emotional sharing of their challenges that are often a sticking point where people don't understand or feel comfortable in engaging in that process. So it's interesting what you're saying about how people have all of these barriers to accessing services and navigating systems, including language barriers, for example, that sometimes it can be an easier process for them to access all the supports that they need in one place, as opposed to having to navigate those complex systems on their own.
Yes. And also, the thing is, a lot of the time, once you are out of the hospital, you have family obligations that you have and responsibilities that you have to fulfill as well. And to take the time to go to a clinic to speak with the psychology or psychiatrist, to take off that time in itself is already a challenge for a lot of
Mm.
community members.
What is something that you wish mainstream organizations understood about your community, like cultural norms or ways of being?
Some of the challenges that I have faced in my experience working as a psychiatrist nurse here in Australia, we value privacy a lot and confidentiality a lot. And that is very important and that is very good. And some hospital or services don't allow non-registered interpreters to be used in their service. So that in itself creates a massive barrier when accessing services. You can't make a certain call for them and you can't bring them directly. And all of these channels, if that can be make easier, that will really encourage our community people to seek support from services. Say someone is experiencing mental health challenges and we are trying to get them access to services. But during assessment, the psychiatrist will ask them about the risk assessment, say if they're how are they feeling, like if they have any thought of hurting themselves or other people, etc. Just because of the cultural barriers, they will deny everything. In our culture, you can't really just be raw and honest with someone that you just met. They have to be a rapport build. And I feel like they're expected unspoken belief or assumptions that once they ask you those questions, they assume that you are being honest with whoever is asking you or whoever is doing the assessment. The reality is those crisis assessment team or case manager, they're a lot of the time they are a stranger to you. So you are just being very polite to them and denying you are experiencing this, you are seeing things or you are hearing things. First of all, you don't know this person, you don't trust this person, and the culturally polite thing is just to say no, you don't. And so a lot of the times they are deemed to be safe to stay in the community. But say if their family members or their friend is telling you she's not well, it's more of what they don't tell you and what the families or the friends are telling you, you should listen. But because in Australia we have our individual rights and we have our individual privacy, confidentiality, and all of that. A lot of the time, family, friends, and community members are not allowed to advocate for them. That makes it really hard for the community members to seek help.
Do you think there is also a lack of understanding around what might happen to them if they answer the truth? I've heard from different communities that they're scared to disclose their mental health challenges for fear that it might impact their visas or their immigration or their having their children taken away from them. Is that something that you hear in community?
What I've experienced is that a lot of the time they don't want to be forthcoming because if they ended up in the hospital, then the whole church or the whole community or their friends, they will talk about them and the stigma. I think it's a major fear that acts as a barrier as well. And
Mm.
that will impact the way that they look after their family as well. For example, isolating them, not going out and not getting help and not talking to other people, things like that.
Such great insight. Thank you, daughter. I wonder if you could comment on what, from your perspective, an ideal mental health service would look like, where people from your community would feel safe and welcome and understood.
For me, look, only if they can have someone to advocate for them and someone to explain for them when they need help. And if they can get help immediately, then I think that's the kind of service that's what's needed in our community right now. And also, I believe we need a lot more education and understanding when it comes to mental health services, how to access mental health services, and the the general understanding that mental illness is not something that you choose to have, or it's not something that you had it because of what you have done. It's just one of an illness that's just like an infection that happens to your body. You can just have that. It can also be caused by a lot of factors, not necessarily just because of what you choose to do or what you have done. And I think that acceptance and understanding will really help. The optimal services for our student community will be a service that provided all these informations and encourage our community to have access to and utilize the existing services as well.
And this leads me to my last question. What role do bicultural workers play in that system?
So as a bicultural workers, we did run informations on mental health, general mental health educations, services that are available, how to access them, where to get help, and many more. Even if it's not about mental health, we do run information about AOD, homelessness as well. And I believe bicultural workers, we did quite a bit for the community. And we are always there to help out with a family or an individual who needs some assistance or help when it comes to filling up form, contacting certain services as well. And we did a lot more than what I can speak within this focus.
I think community education is important, but also just the incredible role that bicultural workers play in building trust and relationships and being that bridge between community and services is so important. And if that means running wellbeing programs or sports-based programs or community celebrations that build that linkage in a less direct way, it's also so meaningful and important.
Absolutely. It really helps to strengthen the community and also give an opportunity to meet each other and sharing ideas. And a lot of the time it's food as well.
Yeah, food is key. Daughter, it's been such a great conversation, and I'm so grateful for your time and for sharing your lived experience and your expertise in the field. So, thank you for joining me on the podcast, and I look forward to working with you and continuing the conversation along the way.
Thank you so much for having me.